basically I've seen the future and it doesn't work. I'll start with the CCG meeting, the Clinical Commissioning Group. It's the THANET Clinical Commissioning Group, and it's all the GP practices in THANET are represented on this group, and it's the new body that will take over the commissioning of healthcare for THANET. They're very well-meaning, I'm sure. Now, we went there on an industrial estate. You'd expect to find a kind of factory there, or an industrial unit of some kind. You go inside, and it's a state-of-the-art conference centre run by this GLOGEN, the Global Generation Church. And it's an amazingly sort of slick place. The organisers said it was cheap, but in fact it looks very expensive. And we were fed lots of sandwiches and lots of coffee and tea. And I always get a bit suspicious when people give it, especially when they're nice sandwiches and it's not just biscuits. So you get a bit suspicious to start off with when you're given that. Then you get the idea that they're consulting you. This was the idea of this meeting, was for them to consult with the people of THANET about what they wanted, because this is all supposed to be about patient choice. And that's what this was supposed to be about, to consult you. But then, as you get further into it, you see that it's not real consultation at all. And in fact, because you sit in little groups and they give you little things to play with, and they set you little challenges, and it starts to ring bells, and you think, well, these are focus groups. This is what big companies do when they're trying to sell you chocolate bars. The twist with this is that they weren't even as interested as a big company was, because they didn't really want to know what we had to say at all. This was my personal feeling, because you weren't allowed to ask questions from the floor, as you are here tonight. What you had were people in your table who were part of the CCG, who were facilitators. They listened to what you had to say, and then fed back to the table. So you're not actually allowed to open a discussion at all. So it's not, they basically are trying to control things. So what you discover they're trying to do, and to be fair, they sort of admitted it right at the beginning. Part of what they call the authorization process, by which a CCG becomes an official CCG, is that they've got to show that they've consulted people. And in fact, they ask you, can we take photos?
There's the evidence.
Listen, this is the evidence that we've consulted our patients, because you were here, we talked to you, we set you some games. I think I've actually got, oh, here we are. They give you, this is the pack they give you, and one of the things they give you is money. So you think, oh great, they're even bribing us with money. So it's not actually bribery, it's actually just fake money. And the idea is, they say, oh, well, there are all these problems in THANET, like drugs and alcohol and care for the elderly. What you've got to do is put your money into different ballot boxes to say where you think the money should be spent.
Do they have a box for them?
No. But basically, so what they're asking you to do is, and then they tell you, well, really, what we're trying to show you is that it's a very difficult process spending money on services. And you think, well, they're just treating you like kind of children. And they take you on a complete wild goose chase, which is not really consulting you at all. And it is kind of worrying as well as being comic, because you think, so these are my GPs, these are the people who are supposed to be looking after me, and they're doing all this kind of mad corporate process that makes no sense at all. But what they do talk about, and what Tony Martin, the chair, talked about a lot, was he put a lot of emphasis on local services. They're going to provide services locally. What they don't talk about is who's going to provide those local services. So, and you're not allowed really, although our group actually forced our facilitator to say that we wanted a choice of having NHS services. In fact, in all the other groups, you could tell that the comments were being filtered out. You were not supposed to say, what I want is an NHS service. That wasn't on the option. What it was is you could have a local services, you could have more services for the elderly, more services for drugs and alcohol, but you weren't supposed to say how the service was supposed to be provided, because that wasn't part of the game. And it was a really diabolical situation. Now, I think one thing we should say is that we will give you these cards, which is what the Keep Our National health service public nationally are provided, which are cards which you can fill in and then give to your GP and ask them, please let me have an NHS provider. If there's any option of having an NHS provider, I want an NHS provider. I don't want to be given to someone else. The thrust of this CCG meeting was that they wanted you to not think about that. They wanted you to just think about the best service locally they could provide. So then they could say, well, it'll be a private company or it could be a voluntary company, but really, what sort of company is it going to be? If you saw a programme by Dispatches, the Dispatches documentary programme about Virgin, Virgin was bidding in every area, and why they could win over other people who were bidding, such as cooperatives of nurses and things like that, is that at the end of the day, they could show that they had the financial and IT capability to win. And that's going to be the way of the future. The financially organised companies are going to get the stuff and other people aren't.